Welcome, everyone. Today we're doing a deep dive into something really common and actually pretty critical during pregnancy: urinary tract infections. UTIs. Lots of you listening might have even had one before, maybe not during pregnancy, but what is it about being pregnant that makes them so important to talk about?
Yeah, it's a great question because, well, UTIs pop up in, maybe up to 8% of pregnancies. That's quite a few. But the really significant thing is if they're not treated, they can lead to some pretty serious issues.
Like what kind of issues?
We're talking potential kidney infections for you, preterm labor,
Yeah.
even things like low birth weight for the baby.
Sure.
See, pregnancy itself changes things. Hormones shift, relax the urinary tract, the uterus gets bigger and can actually block urine flow a bit.
Okay.
It just, makes it easier for bacteria to hang around and cause trouble.
Mm.
So getting diagnosed quickly and treated safely is just essential.
Okay, that makes a lot of sense. So our goal today is basically to cut through any confusion, give you the key things you need to know about, well, how UTIs are checked for, when imaging might come into it, the safest treatments, and yeah, how to maybe prevent them.
Exactly. It's a bit like a perfect storm situation during pregnancy. Those hormonal changes, relaxing things, plus the physical pressure from the growing uterus.
Creates that slow drain you mentioned.
Precisely. A slow drain system where bacteria can just multiply more easily. That's why that 8% figure is notable and why we take even symptom-free bacteria seriously.
Right, that underscores the urgency. So if someone's pregnant or, supporting someone who is, what's the first step? How do you even know if you have one? You mentioned some might not even have symptoms.
Spot on. And that's often the tricky part. Sometimes, especially early on, you might feel totally fine, no symptoms whatsoever. We call that asymptomatic bacteria, basically. Bacteria in the urine without the usual signs.
What are the usual signs people should look out for?
Oh, the classic things like burning or pain when you pee, feeling like you have to go all the time, maybe cloudy or even slightly bloody urine. Back pain can sometimes happen too, especially if it's moving towards the kidneys.
Okay.
But because of that silent type, the asymptomatic kind, routine urine screening, just a simple test, is really critical for everyone who's pregnant.
So even if you feel okay, your doctor's probably going to check anyway. How do they actually do that check? How do they confirm it's a UTI and figure out the right treatment?
It usually starts with what we call a clean catch midstream urine sample.
Right, I've done those. You have to
Yeah.
wipe first.
Exactly. Clean the area, start peeing, then collect the sample midstream. That helps avoid getting other bacteria in the sample. Then, in the lab, they look for signs of infection, like white blood cells and bacteria. But the really definitive test, the gold standard, is a urine culture.
And what does the culture tell you?
It actually grows the bacteria from your urine, identifies the specific type, and tells us which antibiotics will work best against it. That's key for choosing the safest and most effective option for you during pregnancy.
Got it. Okay, diagnosis covered. Now, something maybe less obvious. Imaging, like ultrasounds. When would that be necessary for a UTI in pregnancy? Doesn't sound typical for a standard infection.
And you're right, it's not typical for most simple UTIs. We generally don't need imaging for an uncomplicated bladder infection, but we do recommend it if there are signs that might be more serious, like maybe a kidney infection, think back pain, fever, or if your symptoms aren't getting better even after you've started antibiotics.
Okay.
Or maybe if we suspect something else is going on, like kidney stones or some kind of blockage in the urinary tract.
So if imaging is needed, what's the safest way to go about it, considering the baby? People worry about radiation, things like that.
Absolutely. Safety first, always. Ultrasound is the go-to, the first choice. It uses sound waves, no radiation, so it's considered very safe throughout pregnancy.
And it shows enough.
It's excellent for checking if the kidneys are swollen, looking for blockages, identifying most kidney stones. The main things we'd be concerned about. MRI might be considered in really rare, complex situations for more detail. But again, no radiation risk. CT scans, though, those involve radiation, so we generally avoid them unless it's absolutely critical and other methods haven't given us the answers we need.
Right, avoid, if possible. Now, the big one, treatment. What are the safest ways, the most effective ways to actually treat a UTI when you're pregnant? This must be where a lot of the concern comes in.
It is, and understandably so. But the good news here is that most pregnancy UTIs are treated pretty easily and effectively with antibiotics that have a long track record of safety in pregnancy.
Okay, that's reassuring.
Yeah. We're often talking short courses, maybe 5 to 7 days. Common safe choices include certain types of cephalosporins, an antibiotic called phosphomycin, or specific kinds of penicillin-related drugs. The urine culture helps us pick the best one. Nitrofurantoin is another option, though we tend to avoid it right at the very beginning in the first trimester and maybe right at the very end. Trimethoprim, sulfamethoxazole, another combo antibiotic, might sometimes be used, usually in the second trimester.
And are there antibiotics that are definite no-nos, ones to strictly avoid?
Yes, definitely. Fluoroquinolones, you might know them as Cipro or Lidocaine, those are generally avoided. Tetracyclines are another group, and as I mentioned, some sulfa drugs have restrictions, especially later in pregnancy. The risks just outweigh the benefits when safer alternatives exist.
Okay, so finish the whole course always.
Absolutely. Finish the entire course, even if you start feeling better. And then a follow-up urine test after treatment is really important, just to make sure the infection's completely cleared up. And, of course, if it's more serious, like a kidney infection, treatment might need to be more intensive, sometimes even requiring IV antibiotics in the hospital for a bit.
Right, so treatment sounds manageable with the right care. What about prevention? What practical things can you do during pregnancy to maybe lower the chances of getting a UTI in the first place?
A lot of it comes down to simple, everyday habits. Staying really well hydrated, drinking plenty of water is key. It helps flush things out.
Just keep things moving.
Exactly. Also, don't hold it in when you need to pee. Go when you feel the urge. And try to empty your bladder completely, especially right after sex. Basic hygiene helps too. Wiping front to back, choosing showers over baths maybe, and avoiding things like douches or scented feminine hygiene sprays that can cause irritation.
What about clothing? Does that matter?
It can help. Wearing cotton underwear and looser fitting clothes allows for better air circulation, which can make it harder for bacteria to grow.
Makes sense. And what if someone keeps getting them, like recurrent UTIs during the same pregnancy?
Yeah, that can happen, unfortunately. In those cases, if UTIs keep coming back, a doctor might suggest taking a low dose of an antibiotic every day, or maybe just after sex, for the rest of the pregnancy as a preventive measure.
A prophylactic dose.
Precisely. There's also some talk about cranberry products or probiotics. Some studies hint they might help prevent UTIs, but honestly, the evidence isn't super strong or consistent yet, so definitely talk to your doctor before trying those.
Okay, always check first. So pulling this all together, what's the main takeaway for our listeners? It sounds like if you're pregnant and you notice any of those symptoms, burning, urgency, pain, back pain, fever, maybe blood in your urine, don't wait. Get it checked out right away.
Absolutely. Don't delay. The good news is that we have safe tests and effective, safe antibiotics available. Early detection and treatment are key. And connecting this back, understanding UTIs in pregnancy really highlights something bigger. It shows how paying attention to your body's signals, even the subtle ones, and seeking timely, informed medical advice is just so powerful.
Yeah.
It's about protecting both your health and your baby's health.
Yeah.
And maybe it makes you think, how can this awareness, this understanding of simple signs and available help, change how you approach your health even beyond pregnancy?
That's a great point. It really underscores the power of just being informed and taking early action.